Go.
Hi, my name is Krista Miller. I will be doing a ventrogluteal IM injection on Miss Julia Roberts here. So in my hand I have my MAR, so I'm walking up to my med cart. I'm gonna set everything down on my MAR. I'm gonna set my MAR down on my med cart. Wash my hands. And my 6 rights are right medication, right amount, right time, right dose, patient, and medication. Okay. So I unlock my med cart, pull out my Ketaloric, and get my syringe and my needle. Alrighty. So I'm gonna do my first check, which is Julia Roberts. Julia Roberts, 8/30/68, 8/30/68. The expiration date is June of 2022, so we're okay to give. She has no known allergies, so that's good. And it says Ketaloric on the vial, and it says Ketaloric on my MAR. 30 milligrams IM as needed for knee pain. And it says Ketaloric 60 milligrams IM as needed for pain. That's in the vial. And I'm going to do my second check. Julia Roberts. Julia Roberts, 8/30/68, 8/30/68. Expiration date is 6/22, so we're okay. And the Ketaloric on my MAR, it says 30 milligrams IM as needed for knee pain. Then we have 60 milligrams IM as needed for knee pain. And we're doing this at 4 o'clock in the afternoon. And so then I grab my alcohol swabs, or alcohol wipes. All right, and then we're gonna swab the vial here. So we're gonna swab for 15 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Throw that one away. Alrighty, let me get my syringe out. It looks good. There's no damage to my syringe. Unscrew the cap, throw that away. Get my other alcohol wipe, cleanse that for 15 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. All right, and I grab my needle. And I sterilely open it, put my needle on. Okay. Throw that away. All right, and then I fill this with 1 milliliter worth of air, because that's how much I'll be giving to Julia. That I figured out. And then I uncap my needle, and then I'll put that needle right here. And then since I don't have a vial, we're using a Subway cup to get the medication out of. So I'm injecting the air into the vial. And I'm going to drop the 1 milliliter worth of fluid. Okay. Okay. That up. And there is 1 milliliter of fluid in the vial.
Okay.
Now I'm going to use the scoop method. I'm going to use the Ketaloric as my stopper here. Okay. The needle's not bent. Everything looks good. All right, and then I have my second nurse, or that'd be my my last check would be with the nurse. And I'm gonna just do it one more time, making sure. Julia Roberts, and I have Julia Roberts, the Keteloric. And we're getting 1 milliliter worth of fluid in there, and I do have that. And then her date of birth is 8/30/68, 8/30/68. She has no known allergies. The expiration is June of 2022, so we're okay. All right, so I'm gonna put that down, set that down, put everything away, throw everything away that's empty. Grab some of my alcohol swabs with me. Grab my mark, or lock the med cart. Make sure double check there's nothing on my med cart. Nothing is. So I'm gonna walk to Julia Roberts' room. Knock, knock. Hello, Julia. My name is Kristen. I'll be your nurse today. I hear that we're having some left knee pain. Is that correct?
Yes, that is. I just had surgery.
Oh, wow. Close that door, close the curtains, wash my hands, set everything down, rewash my hands.
There it is. Okay.
Alrighty. So, can you please verify me your name and date of birth?
Julia Roberts, 8/30/68.
Perfect. Thank you so much. Alrighty. I'm gonna wash my hands. Alright, so I'm gonna give this in the left ventral gluteal, this injection for your left knee pain, okay?
Sounds good.
Alright, so I'm gonna try to find the great trochanter, which is right here. And then my pointer finger is going to be pointing towards the anterior superior iliac spine, or towards the umbilicus. And then my other 3 fingers are going to point and find the anterior, or the posterior superior iliac spine. And then so in this V shape, I'm gonna give the injection right here. So I'm gonna go and wash my hands again, glove, alrighty, so do that V shape again, and hold on. Oh yeah, I grab my alcohol swab, I clean the area, 1, 2, inner and then outer, so do that for a couple, 5 seconds, okay, throw that away, let it dry. All right, then I go and try to find the great trochanter again, find my spot, found it, take my cap off. Maybe I'll just do it this way so I don't hurt anyone. Alrighty, upright position at all times. Alright, try to find it again. Alright, and then I go in at a 90-degree angle, and then I aspirate, and I don't see any blood, so we're okay to inject. So when I inject slowly, all right, and then I come out upwards, and then safety is on, and then I throw that away in the sharps, get a gauze, and I dab the site if there is any blood. And then I tell Julia, do not rub the site because it could irritate the Keteloric.
Okay.
And the Keteloric is used for mild to severe pain, so it should help with the pain.
Perfect.
And I'll help you on your back or however you want to lay. Alrighty, perfect. Alrighty, so then I'd get rid of my gloves, throw them away in the trash, throw all my stuff here away in the trash. Make sure the sharps was off the wall. Alrighty, and make sure she has her call light. the bed's in the lowest position, the rails are up, and if there was any blood return, then I would have to restart all over again. Because I hit an artery or some nerves, which isn't a good thing. Okay, and then I would go and say, would you need anything else, Julia?
No, thank you. I'm good.
You're welcome. All right, you have your call light?
Yes.
Alrighty. So then I'll grab my Mar and go out the door. Tell her thank you. Go out the door, wash my hands, set the Mar down on my med cart, and then I would document. So we gave a ketaloric at 1600, so at 4 o'clock in the afternoon. And the date is 10/13 of 2020. And then I would give my name and then signature. PNS. And then the ventral gluteal, I gave it in the left ventral gluteal site. And then initial, and then I go on my back and date 10/13 of 2020, and the time was 1600. Medication was the ketaloric, and the dose was 1 milliliter. Route was the ventral gluteal. I'll just do VG, and my initials, IM. And then the reason was for left knee pain, and the results was that she felt better, felt no pain, I should say, after it was given. And that time when I checked on her was 4:30, and my initials, and then my signature down here, PNS, and then KM, and then I'm done.